To treat Hilda, Mr. Stephen Quinn will carry out a procedure called a myomectomy, where the outer and inner layers of fibroids are surgically removed one by one and the womb repaired.
One of the big risks with this type of surgery, Hilda, is bleeding.
Yeah.
So we have to be very careful. As we remove, first of all, the bigger fibroids and then the smaller fibroids, we have to really carefully control that bleeding as we go through the surgery.
If Mr. Quinn is unable to control the bleeding, he'll have no choice but to remove Hilda's womb. This is called a hysterectomy and would prevent her from ever getting pregnant in the future.
Come on, Elizabeth, let's do this. You can do it, Elizabeth. I know you're very good.
Hilda has 10 nieces and nephews and is so close to Lewis kids they call her auntie.
Can you say your alphabet, Elizabeth?
But so far, Hilda has no children of her own.
With the kids, it's mixed emotions. I'm happy that she loves them, and on the other hand, I keep thinking, I want C for her.
C for cat, Elizabeth. Cat.
Long term, I want little Hildas. I want her to experience life fully.
While surgery does come with the risk of losing her womb, it's still Hilda's best chance if she wants to have children in the future.
We're trying to avoid hysterectomy, but I really want to try and avoid it if we can. So surgically, we're going to try and do this as carefully as we can to try and keep everything together.
It's incredibly clever what they do. You know, in that.
I'm glad that we're here today. I'm glad that I'm going through this surgery. I'm ready for it. I'm mentally prepared for it. I'm glad.
Fifty-year-old grandmother Trudy is hoping for a life-changing solution to her frozen shoulder by going down the injection route.
If you come round over here, I can show you where the needle's going to go in if you want.
Yeah.
And we advance it.
I just want to be able to sleep at night, be able to use my arm normally, and to be pain-free, to be honest.
In the hope of giving Trudy back mobility in her shoulder that's been stuck in place and causing terrible pain, she'll undergo a series of steroid injections at St Mary's Hospital in London.
Whenever you're ready, lie on your right-hand side.
That should reduce the inflammation and loosen the joint.
This is the live injecting hydrocortisone in the shoulder capsule.
Seeing the 3D image of my shoulder really did help me in my own mind be able to visualise it and, you know, help me cope with what I'm actually going through at the moment, and knowing that if I didn't do anything, the pain would continue, and it was at a point that I either choose this or I try and cope with it, and that really wasn't an option.
Okay, so little scratch coming out.
Using an ultrasound to guide the needle, radiologist Dimitri starts by administering an anaesthetic to help numb the area.
Let me know how you're feeling. Sorry.
I don't want to have to rely on anybody else for anything. I just want to be able to get on and, you know, live my own life and be independent.
Second syringe is needed to inject the steroid and some saline to stretch the joint capsule.
I can see you're under a lot of pressure in that joint. The fluid's coming out as we're putting it in.
Despite the anaesthetic, with so much pressure in her shoulder, the procedure is extremely painful. Trudy must keep still or she risks pushing the needle and the steroid out of place.
Okay, so now we're going to try and put some fluid into the joint. This may hurt. Just tell me what you can tolerate. Don't be brave. You okay?
Oh.
I'll let off some of the pressure there.
Doing so well.
Well, there's no doubt you've got a frozen shoulder.
Oh. Doing so well.
Once administered, the saline will expand the capsule of Trudy's shoulder, stretching out the tissue and loosening the joint.
Still sore. Okay. Well, look, I think that's really good. We've got in some local anaesthetic, we've got in some steroid, and we've managed to stretch the capsule as much as we can. So we're going to stop there. I don't want to cause you any more pain.
But this won't be an instant cure.
You've got a very tight capsule, as we thought from the scan, and the steroid in there is going to start working. It's going to start easing up in the next couple of days, but it's going to feel a little bit tight at the moment, I'm afraid. And then you may feel that it kind of twinges during the day, and you may sometimes feel a pop, and that is actually some of the fluid escaping because it's so tight.
So that's good, essentially.
Yeah, exactly.
Right, okay, so if you hear a pop, it's not.
Yeah.
It's a good thing. It's a good thing.
Just be careful as you sit up, yeah.
Over the coming weeks, Trudy will have further injections and a course of physio to stretch the joint more and hopefully over time return it to its normal, flexible, pain-free state.
You're looking better already. You are. You went so white. I was terrified. Oh, you couldn't even say it to me straight.
I couldn't, no.
You were at the action end. I was at the emotional end.
At St Mary's Hospital in London, it's the day of Hilda's operation.
I'm very hopeful that's going to go well. So, yeah, I'm looking forward to it. I just want to get over it, and move on with life.
Having discovered at our imaging centre how serious her case of fibroids has become, she's decided that surgery to remove the growths is the best option.
Hopefully, by the end of today, I'll be fibroids free.
The doctor in charge of Hilda's procedure is Mr. Quinn.
Having the 3D consultation before the surgery has been very, very helpful. It's allowed myself to look at all the position of the fibroids, so I've got a very clear idea of exactly what's required in terms of the number of fibroids that we remove. Obviously, we have to do that safely, and we might not be able to get every fibroid, but we're going to do our very best to do as much as we can and try and restore as much of Hilda's normal uterus as we can today. How are we doing, guys? Are we all set? Fantastic.
Mr. Quinn has a big task ahead of him. Our imaging centre revealed more than 90 fibroids spread throughout Hilda's uterus.
It is a very complicated operation for a number of reasons. Firstly, simply the number of fibroids that Hilda has and the size and the location of the fibroids.
She wants Mr. Quinn to preserve her fertility, so each growth has to be removed individually.
And we're going to be making our midline incision in this area here.
But it's not straightforward.
Going into this operation, I do understand that there is a risk of hysterectomy based on the number of fibroids that are growing within me. The doctors can only try to do their best.
Before Mr. Quinn can remove the fibroids, he needs to lift Hilda's uterus out of her abdomen so he can see what he's doing.
Can I have a table up just a touch, please? Lovely, thank you very much.
It has to be taken out extremely carefully to avoid damaging any of the surrounding organs.
So we've been able to open Hilda's abdomen, and we've been able to deliver the uterus through the abdominal tissue.